It's board-certified emergency medicine physician, Dr. Travis Stork. So hopefully the Stork will deliver me all of the information I need, because
I will try.
It sounds scary. It sounds like if someone who has Alzheimer's sneezes or coughs on you, you're going to contract the illness, which is terrifying.
And it's a classic case of wrong headline for the research that was done. And it's scary because Alzheimer's, look, we're still learning so much about it. But for people to spread this idea that it's infectious is wrong.
But you can actually get it from the amyloid proteins that...
Well, this was looking at a very unique situation.
But there's a thing in someone, and if that thing goes inside of you, you will get what they have.
Well, again, this was...
That's kind of scary.
These were children who were given human growth hormone from cadavers. Mm-hmm. And there was some thought that maybe some of the proteins that can lead to the plaques was spread from the cadaver to the boys.
And how is that not contagious?
Well, because again, number one, more research needs to be done. This was you can't necessarily prove cause and effect there.
Yeah.
But more importantly, this is number one, this isn't done anymore.
Yeah.
And number two, when am I ever going to go inject a needle in my brain and then inject it in yours? Never. So it's not a realistic scenario.
But what if the proteins can't be sterilized off of the like, what if you have a gamma knife and you do brain surgery on someone and then the proteins can't be scrubbed off of it?
Well, then I can't solve your problem. And I don't mean to make light of it, but I think,
how dare
you know, it's important when you're a doctor, you're sitting here trying to help with a lot of the myths out there. And And so you're right. It's scary because the headline is, when I read the headline, I'm like, wait a minute.
Yeah, because you've been around a lot of people who've had Alzheimer's. What is the first symptom of Alzheimer's?
Well, forgetfulness. And, you know, it's very subtle. And a lot of times people don't recognize it's happening to them, and then people don't want to acknowledge it. But the biggest thing is if you know someone and you fear they may be developing symptoms of dementia, go get it checked out. Because it's not just Alzheimer's.
Yeah.
Sequential strokes can lead to dementia. A lot of things can lead to dementia.
Interesting.
And some are more treatable than others. So it goes without saying, though, that if your loved one has Alzheimer's, it's not contagious.
No, it's a horrific disease.
It really is. And dementia in general.
One of the worst ways, one of the worst degenerative things that a human being can go through. It's awful. And now that we're having so much fun, let's talk about dying and death. Yay! A supercomputer at a hospital in Boston can reportedly make fast disease diagnoses that might save lives, but also has stunning accuracy at predicting patients' impending death with near perfect scores. All right, so our robot death forecast, the wave of the future.
So you had an ER doc on today, so you decided all we're going to talk about is really scary things.
Well, are you a Donald Trump supporter? I guess that's my other question.
I'm ignoring politics. I'm not going there. But I will tell you, I watched this artificial intelligence machine put into practice, and this is purely my opinion.
Okay.
I think machines can do a really good job of diagnosing very unique illnesses. There are illnesses out there that we rarely, if ever, see. And so if a machine/computer can put all the symptoms and data into a computer...
It's like Dr. House.
In a way, you know, but
in a laptop.
In a way, because Dr. House isn't real in real life. And
maybe
he's fictional.
You, Dr. Travis Stork.
But he would always come up with the unique diagnosis. So I think there is a place for it in that regard. But where I want to caution people is it's another headline of it will predict when you're going to die.
Yeah. So it's like a digital death panel that sucks for everyone. Well, that's no good. Like you just plug your info in, little vial of blood, and it's like you got about 35 years.
I'm not buying it.
Make the most of it. Start canoeing.
I'm not buying it. And who wants, you know, not to make light of it, who wants to know when they're going to die, number one? I don't.
I don't either. That's why I don't see psychics.